Well, good afternoon, everyone. My name's James. I'm a dietitian, and this afternoon I'll present a summary of progress so far with my PhD, which I'm 2 years into with 1 year to go. And I'm doing a mixed method study investigating gastrostomy feeding in children having a bone marrow transplant or BMT. So I'll start with a brief background. So children need a BMT as a potentially curative treatment for conditions including relapse leukemias and immunodeficiency syndromes. Great Ormond is the largest paediatric BMT centre in the UK, and we transplant children from a few months old up until about 13 years of age. So what are the nutritional issues that these children face? So BMT starts with the child receiving a week of very intensive chemotherapy that leads to a range of side effects that negatively impact their oral intake, including anorexia, vomiting, and ulceration of the lining of the digestive tract known as mucositis. So these children are at very high risk of malnutrition, and this has been associated with a number of poor outcomes, including survival. So optimal nutrition care is absolutely essential. So the problem I'm trying to address goes something like this. The families meet with the BMT team over a number of consultations leading up to their child's admission. And quite simply, the parents have to make a choice between one of two feeding tubes for their child to use during and throughout BMT. The most commonly used tube is a nasogastric tube placed simply during the admission. However, at Great Ormond we offer families an alternative, a gastrostomy that's placed prophylactically in the weeks prior to BMT. This is always something that fascinated me in clinical practice and led to me wanting to do this research. And coming into this PhD, there actually wasn't much that we knew about this phenomena, including which of the hospitals use gastrostomies. A focus group I did with our national BMT dietitians group showed that gastrostomies were seldom used in other UK centres, with the biggest barrier to their wider use is perceived risk of infection in immunocompromised children. On the back of that, we don't know how safe gastrostomies are in BMT. Some studies have shown them to be safe, other studies associated with greater risk of infection, so there's a need to systematically review the literature. We don't know how their outcomes compare. One of my own previous pieces of work is one of the few studies out there reporting a range of outcomes, and we found gastrostomies associated with less use of parenteral nutrition during the BMT admission, but that was retrospective work which limited the outcomes that we could look at, so there's a need to do some prospective work. We also don't know why some families choose a gastrostomy or not. This research is primarily in children with neurological disability. So the gaps in the literature and our understanding of this topic have informed the 5 objectives for this review. Firstly, to systematically review the literature for complications of gastrostomy feeding. Secondly, to survey national use and opinions of clinicians towards gastrostomies. Thirdly, to do the prospective work comparing complications and outcomes between both feeding tubes. Fourthly, to explore why families choose one tube or the other and how their experiences compare. And finally, to create a storybook telling the stories of families and their feeding tube. The study design to meet those objectives is a multi-phase, I can't quite see that, it's a multi-phase parallel mixed method study. So there are 3 phases. Phase 1 contained the systematic review and national survey, and the outcomes of those informed the outcomes for investigation in the cohort study and the topic guides in the family interviews, both of which make up phase 2. And phase 3 will converge the outcomes from the previous pieces of work to create the storybook. And I'll summarise progress so far with each piece of work, starting with the systematic review. So the question being addressed here was, what are the complications associated with gastrostomies in children undergoing BMT? Articles retrieved from database searches were independently double-screened by myself and another researcher, and following that, data was extracted and risk of bias assessments took place. There were 5 cohort studies, you can't quite see that at the top, there were 5 cohort studies and 11 case series studies that made it into the review. As you can see, the quality of these studies varied. Common weaknesses included the absence of randomization, retrospective designs, and small sample sizes. But a summary of findings were that 55% of children did get one or more complications with their gastrostomy, but they were mostly minor in nature, very easily treated. Only about a quarter had what were classified as major complications, typically an infection needing intravenous antibiotics or removal in severe cases. On to the national survey. So the aims here were to understand gastrostomy use across UK BMT centres and to compare opinions towards gastrostomy between dietitians, nurses and consultants. 12 centres were invited to take part and complete an online survey, And within each centre, the survey was completed by the lead BMT dietitian, clinical nurse specialist, and consultant. And we got a 100% response rate from all 36 clinicians. A summary of findings were that roughly 60% of centres did not use gastrostomies, but 42% did use them in some children. However, among 21 clinicians in the 7 centres that were not currently using gastrostomies, 76% felt that some children should be offered the choice of a gastrostomy. 14% felt all children should be offered the choice. Only 10% felt gastrostomies shouldn't be used in BMT. The most common advantages of gastrostomies compared to nasogastric tubes were less tube displacement and better cosmetic appearance, most common problems, risk of surgery, and risk of infection. When these responses were compared between the dietitians in the first column, nurses in the middle, consultants in the last column, looking at the problems, the consultants were more often concerned about the burden of gastrostomies to the family and the negative impact on the child's body image. There was far more disagreement when it came to the advantages, with dietitians and nurses more often than consultants reporting the cosmetic benefit of gastrostomies and the ease and ability to provide long-term nutrition. Onto the cohort study. This is currently underway. So the aim here is to compare complications and a range of outcomes between children fed via both feeding tubes. It's a single centre observational study. There's no change to decision-making practices or clinical practices. Recruitment started last April and ran over 1 year. It's recently stopped a couple of weeks ago. We've got 19 children in the nasogastric group, 24 in the gastrostomy, with an overall 88% recruitment rate. Children are being followed up for 6 months from the day of BMT, so data collection is due to stop later this year. And we're reporting or collecting data on a range of outcomes, including any adverse events with either tube, what the tubes are being used for, various anthropometric markers, and nutritional intakes from oral, enteral, and parenteral routes. And finally, the family interviews. So all parents from the cohort study are invited to take part in these, and each parent is interviewed both pre and post BMT to see how their opinions change. The first interview happens on the child's admission to the BMT ward and focuses on why the family chose a gastrostomy or not, so getting both sides of the arguments. Interviews take place face-to-face in the child's individual room on the BMT ward and cover topics including what the family were told about tube feeding, where they offered the choice of tube, why did they choose the tube that they did, what was it like making that decision. The second interview happens a couple of months post-discharge to give families time using the tubes at home themselves and focuses on really how the experiences of both tubes compare. Interviews take place in the BMT clinic and cover topics including how they found using the tube, what's it been like to look after and maintain, what problems happened with it. If they could go back to the start of BMT, would they still have chosen the same tube? And should we offer families the choice of feeding tube? Emerging findings are that when it comes to choice, there's a spectrum of how free that choice is. Families are, of course, influenced in their decision. At one end of the spectrum, they have complete freedom. We chose, versus at the other end of the spectrum, we were told which tube to have by the clinicians. The difficulty of the choice is a spectrum. At one end, some parents find it very easy, go with almost a gut reaction of which tube they feel is best for their child. At the other end of the spectrum, some parents find this a really difficult decision to make. Of course, parents make a choice based on information provided by the BMT team. Sometimes that information is conflicting, which makes the choice even harder. The parents really value lay information, which they get from other families they know from the hospital, social media. They also go online and thankfully tend to trust or go for trustworthy sources. There are concepts about who the experts are here. Thankfully, they always value and trust the advice of clinicians, but sometimes the parents are the experts in their child. They know their child better than anyone else and know which tube would be best. All parents want the choice of feeding tubes to be offered. When it comes to tube feeding, there's an appreciation that one size does not fit all. So what difference will this research make? It will improve patient care by producing new evidence regarding the topics being researched. And hopefully that new evidence will allay the concerns of clinicians raised from the survey and support their advice when discussing tube feeding with families. Hopefully it will lead to equality of opportunity. Why shouldn't a family whose child's having a BMT in another UK hospital be offered the choice of feeding tube? And the storybook will help families in their decision making in choosing a feeding tube for their child. Finally, thank you to my supervisory team. Some of them are present today, and thanks everyone for listening, and I welcome any questions.